Let's take a look at the big story we're talking about today, which is how occupied are hospitals right now in big cities where COVID numbers continue to rise. And beyond a point, with Omicron, that big number that you see every day across the country, across your city, really looks large. But the real number to watch, honestly, is the number of people making it to hospitals, the number of people making it to ICUs, and the fatality rates. How many people are dying because of this third wave? To say that there are no deaths would be incorrect. To say that there's no one in hospitals would also be incorrect. But they're relatively low. What does relative mean? So let's take a look at the data. Let's just show you some of the data we've crunched. So from Jan 1st this year, we have seen cases in Mumbai pretty much explode over the last few days. In fact, by Jan 7th, we're seeing 20,000 cases per day in Mumbai. Look at hospitalization. On Jan 1st, you had 2,760 hospital beds occupied because of COVID-19. And all of this is official data that the authorities put out every single day. By Jan 7th, you've gone to 6,531. So you've more than doubled in a matter of a week in Mumbai. Let's go across and see what's been happening in Delhi. So in Delhi on Jan 1st, you had 247 people in hospitals because of COVID-19. Again, official Delhi government data is what I'm citing. By Jan 7th, the number has gone up almost to 1,400, 1,319. So multiple fold jump in just a few days. Let's quickly just look at the death rates, the mortality rate. So the mortality rate and the increase in mortality rate statistically is much lower in Mumbai and Delhi. I'm taking these two cities because they're showing the highest number of cases and they're highly populated cities, so it can give us an indication of what's happening across the country. So Jan 1st, in Mumbai, we had one death. It's increased to 6 deaths in Jan 7th, but it's been pretty static, not a massive jump there. And that's the great news. In Delhi as well, we have seen a steady increase from one death on Jan 1st, that's COVID mortalities, to 9 on Jan 7th. So we have to be very, very careful. And the key question right now will be how prepared hospitals are. To speak on this, I'm joined today by Anil Vinayak, COO of Fortis Healthcare, Vivek Nangia, Principal Director and Head of the Pulmonology Department at Max Super Speciality Hospital is with us on the show today as well. Dr. V. Ravishankar, COO at Leelavati Hospital in Mumbai, is joining us on the show, as is Dr. Anupam Sibbal, Group Medical Director at Apollo Hospitals. Welcome to the show to all of you, and thank you so much for speaking with us today. Dr. Sibbal, let me begin with you and get an overview of the question that we have placed, with the point in mind that this is, of course, not to alarm people, but it is to understand what we are in for with the rate at which hospitalizations are increasing. What is your take on that?
Good evening. Pleasure to be on your show. So basically, as you have given the data, the numbers have increased considerably. Of course, the silver lining has been the need for hospitalization is not what it was with Delta. The need for ICU care is not like it was in the second wave. And of course, we've had the mortality figures much lower. And this is really panned out across the globe because we know that Omicron is more transmissible, but it produces a milder disease, which of course is reassuring. Having said that, the sheer volume of cases, even if the percentage of individuals needing admissions is going to be much lower, is really going to be quite large, and therefore all health systems have been preparing. The government has issued notifications. The government sector, the private sector, all, as they did in the wave 2, worked hand in hand and augmented capacity. For us at Apollo, I mean, as the largest private healthcare provider in India, we earmarked 2,000 beds should the need arise. And when I was looking at data from last year, we hit 115,000 patients on 6th of April. And at that time, we had about 1,040 COVID admissions. And when I look at 115,000 today and we look at the number of admissions, it's about a third of that number. Having said that, we are prepared. I think there were lots of lessons from the second wave. So whether it's infrastructure, whether it's training, whether it's protocols, whether it's availability of consumables, whether it's oxygen, I think we are better prepared today than we were. Of course, the biggest challenge we see with the increased transmissibility is that the healthcare workforce, despite the fact that they're all vaccinated and that they're going to get the precautionary dose from the 10th, remain vulnerable. And we are seeing this across the country that healthcare workers are getting infected. And therefore, we put in place measures to decrease the chances of that happening with very strict compliance with masking and no two healthcare workers eating together or having coffee or tea together, using the COVID avoidance behavior protocols that we have, transport of nurses, not using air conditioning and having the windows down in buses. So lots of measures in place really to make sure that we are well prepared to face what we might have to face in the next couple of weeks.
What is the estimate of what we may have to face? That's the question. Let me come to you, Lieutenant General Dr. V. Ravi Shankar. We showed our viewers the Mumbai numbers a short while ago, and the jump in a week, and I've taken just Jan 1st to 7th. This is from where the numbers overall have really started going up. Though in Mumbai, we've seen the numbers going up since the 21st of December, but the jump in the last 1 week, we have seen a proportional jump in hospital requests. Are you on ground seeing more people coming in?
Good evening, Tamanna. The fact that there has been a sudden onslaught from the time that the city and the country celebrated Christmas is testament to the ground reality that there has been a quantum jump in the number of patients who are coming to the hospital. Notwithstanding the fact that, yes, they are milder cases, the virulence is low, but the infection is spreading very, very rapidly. At Lilavati Hospital, frankly, we never shut down any of the COVID ward or the ICU. We had only scaled it down. And the moment we found that the cases were coming during Christmas, we actually ramped it up. I'm still in the process of ramping up the ICU beds. In fact, in Mumbai, amongst all the private hospitals, we probably have the largest number, 48 COVID ICU beds and total 190 plus COVID beds, and we are a 330 bedded hospital. So we've always been prepared, and SOPs were in place, and we learned a lot in the second wave from the first wave, and obviously now we're very well prepared. The cases are mild, the oxygen requirement is not much at all. There are admissions in the ICU. In fact, last night itself, I had about 6 admissions. Today, I've had patients being transferred from other hospitals into the ICU, but frankly, they won't not gone onto a ventilator. They may be on NRBM, they may be on NIV, but frankly, none of them have gone onto a ventilator, which is a very good sign because we know that this particular strain is affecting the upper respiratory passages. It is not producing the COVID pneumonia, which we saw during the Delta wave. And the fact that we are not doing so many CT scans either. The CT scans we did during the Delta wave, almost all had shown evidence of COVID pneumonia. The odd cases that we do now find that actually the CTs are crystal clear. So the infection is in the upper passages. The drawback of that is it spreads very rapidly, coughing, sneezing, any of these droplet maneuvers, it spreads. And the fact is, it takes just about 10 seconds to spread from person to person, unlike the Delta wave where we were experiencing that you have to be in closed areas for 2 to 3 minutes before it spread. So I think the sheer volume is humongous, but the hospitalization is still very well under control.
Okay, so hospitalization is very well under control. Now the question is about preparation and scaling up. Mr. Nangia, would you like to come in on this? How are you scaling up or preparing to scale up if the need arises? And of course, here as we speak on this, we are hoping that the need doesn't arise, but we have to see the trend line where hospitalization demand has also increased, isn't it?
So luckily, so far, all the patients that we have got admitted with us, out of them, about 80-90% of them are those who are incidentally detected positive. You know, they had come to the hospital for some other problem and were found to be COVID positive. So they are there in the COVID area now being managed for their other problems, while COVID is being co-managed. So they are there not for COVID, but have been found to be detected to have COVID. People who are coming to us with COVID purely are only 5 to 10% and not more than that. So as of now, we have a limited availability of beds, but we are going to keep adding on as the number of patients keep going up. So we have a complete plan in place where the Initially, the limited number of beds, then extended number of beds, then an entire floor, then an entire building. So we go like that. Of course, we have enough trained manpower. Also, new nurses and paramedics have also been recruited. They're all trained now. We're also prepared in case there is any increase or surge in the pediatric number of cases. So there's a dedicated pediatric wards also that has come in place. Most of the hospitals are now self-reliant as far as the oxygen is concerned. The oxygen plants have started within the hospitals now. The supply chains are in place for drugs and consumables. The nursing rosters are well prepared. Backup plan is also ready that in case the healthcare workers themselves fall sick and need to be isolated, so that 7-day isolation policy is being strictly followed and everybody's coming back to work after 7 days with masks on for another 2 to 3 days. And the clinical SOPs based on the global trends of the disease are in place too. So I guess we are all very well prepared for it now. Although one doesn't want and doesn't hope that it reaches that level, but yes, if it does, then we're prepared for it.
Mr. Vinayak, of course, I want to know what your preparation and ground experience is currently, but also talk to me about the lessons learned from the second wave, which for a lot of hospitals was this sudden need for oxygen. This seems unlikely right now because, as all of you doctors have explained, this is not impacting the lungs as much. Even so, what are the preparations that have been added and lessons learned from the Delta wave?
So from the first 2 waves, Tamanna, we've learned a great deal. And I think all of that is coming together to prepare us for the third wave. Like everyone said so far, what we are seeing is a milder disease in the sense of less of ICU requirement and less oxygen requirement. And also we are seeing shorter stays. And that will be a very important factor when we look at the bed requirement going forward. And the second piece is that largely the requirement is for wards, and the ICU requirement as a percentage when you compare it to Delta is far lower. Now, in terms of the protocols, etc., I think the Delta taught us that you really need to think of what can go wrong and how do you prepare for that. And in this particular instance, the manpower of trained medical staff is one thing that is going to be probably our most precious asset, simply because of the very high infectivity of the COVID variant. So what we are doing is to focus a great deal on that side of how do we protect staff and how do we make sure that we have adequate people to man the beds. On the bed side, frankly, we are quite confident because we have demonstrated in the past the ability to manage almost 60% of the entire network beds were being used for COVID treatment in the second wave. Today, we are just about 10% of the total so far. So we know we can go a long way before we start to panic. And we are well prepared, like others have said as well, when it comes to supply chains, when it comes to oxygen plants, all of that is ready as well. So between the shorter stay, the fact that we are far better prepared, and the larger requirement for ward beds, which are easier for us to reclassify, I think and the last piece I'd like to mention is that I think the awareness has come in a very timely way. When we look at the general public's awareness of the infectivity and the precautions that they've now started to take, as well as the restrictions that have come in from the government, I think that will help us to flatten this to some degree. And therefore, we feel far more confident of being able to handle this in comparison to what we faced in the Delta wave.
Also, the big factor that many more people are vaccinated as compared to Delta. We've crossed 150 crore doses today, which will boost, our preparation. But 2 of our speakers mentioned the vulnerability of healthcare workers getting infected and thus being out of action in large numbers. Let me get a perspective from Dr. Ravi Shankar on this as well. Is that something that we're already beginning to see?
That is actually a major problem in almost all the hospitals across the country. So it is in Mumbai. My take on the booster doses, I feel it should have been given at the end of 6 months of the second dose. We could have saved a lot of people. Now it has come after 9 months of the second dose. So we are starting on 10th. that is going to play a very, very important role. The patients who are coming, certainly, almost all of them are doubly vaccinated. There are breakthrough infections, there are reinfections, but it still remains mild. So I feel that vaccination will go a very long way. It is not to say that vaccine is a safe Omicron vaccine. It is just that amongst all the other precautions, this is definitely one of the most important. And like the previous speakers have said, we have also ensured that we don't have community meals amongst the staff. Leelavati Hospital itself has got about close to 150 nurses who turned positive, 30 odd doctors, and I'm actually struggling now to make sure that the staff is available. So we have various plans, contingencies, we are hiring, recruiting, and I'm hoping that this is also a passing phase.
Yeah, we hope it passes through. And, I'm just thinking of healthcare workers who have borne so much through all of this and now have to be denied even the joy of having a cup of coffee with a colleague. It's truly a cruel time for them. Mr. Nangia, just your take on the shortage of healthcare workers and how we plan to address that.
So far, we're not facing a shortage of healthcare workers. We definitely have a few of our colleagues who are down with COVID. But there is no shortage as in shortage per se. But if this trend continues, then maybe we land up in a situation. But we need to understand that the duration of the isolation is also now reduced to 7 days only. So, the turnover will be quite rapid from that point of view, I feel. And I think we should still be able to manage it very well. Although I would say that, yes, even the healthcare workers need to follow appropriate precautions. But despite all possible precautions yet, we fall prey to it, and that's only natural to happen because there is so much of disease and illness all around us. We have patients walking in who are at times, despite knowing that they may be carrying COVID, still walk into our OPDs without appropriate precautions, wearing appropriate masks. There are times when people turn out to be positive incidentally while a procedure is being performed, so the entire unit comes down with COVID. So all those things need to be in place. There has to be a proper check. There has to be a kind of a screening system in place where every patient coming in first needs to declare whether they have fever or any symptoms suggestive of COVID or not. So I guess those are things that we can do to improve and protect our healthcare workers.
Yeah. Dr. Sibal, let me come to you on the question of booster doses. It rolls out from Monday with a 9-month gap, and it's for healthcare workers and those above 60 with comorbidities signed off by a medical officer. Are private hospitals going to be involved in this process? Are you seeing that registration coming in?
Well, absolutely, Tamanna. From last year, 16 January, when the program was launched, I think the private sectors played a very important role in making sure that we provide facilities for vaccination. And it's really heartening to see what we've seen with teenagers. And as a pediatrician, it's really heartwarming to see the enthusiasm that parents have shown. The fact that we've had as many number of teenagers come and get vaccinated in the last 4 days is very positive. And I think as far as healthcare workers are concerned, obviously everyone, according to the calendar, the moment they complete 9 months, are scheduled to get their shots starting on Monday. And we've had a lot of individuals who are older than 60 and have comorbidities interested in getting the vaccine. So I think the vaccination awareness has over a period of time built up considerable traction, and that is the reason we have 150 crores. It's a huge achievement, and I think we should pause and actually applaud the system. And when I say the system, the entire machinery, from the production of the vaccines to the distribution to the healthcare workers who've gone off to far-flung areas to vaccinate. It is really remarkable. 150 crores. It's huge. And having done that with indigenously manufactured vaccines, it just shows the strength of Indian healthcare. It shows the tenacity. It shows the spirit of innovation. And I think we need to celebrate that. I also just wanted to highlight here in terms of managing the staff, healthcare staff, infections. So, we, for example, have 39 hospitals that are geared up for managing COVID patients across 14 states. So we also have a plan in place so that if a particular hospital, a particular state needs doctors or nurses, then we will fly them into that areas to make sure that we are able to work up to full capacity. So every day we review what the ground reality is across the system and see what can we do to strengthen our preparation should there be a need.
Yep, absolutely. Perhaps healthcare workers should have started booster shots earlier. That would have put us in a better situation. But COVID-19 continues to be unpredictable, leaving us to think on our feet. And that is how top hospital chains are currently preparing. Thank you so much to all of you for joining us on this very informative and important chat this evening on the India Development Debate.
Thank you.
Thank you.
Thank you.
Thank you.